As someone who lives about 10 minutes from the Alac border, I can tell you there were numerous problems with the policies, with the implementation, and I'm concerned that I'm not really seeing some of these things showing up in the report. I had higher hopes for what might be uncovered and what might be discussed. I don't see anything about how the business community was impacted by the implementation of the mandatory orders. There were many issues with that. How traveling workers were treated. There are so many people in my riding who cross the border every day, and how they were treated and how the different decisions made and how they, by public health, by health, but how they were implemented at the border, how there were unmarked cars chasing people down on the highway, and it was under public safety's supervision that this happened. And it was not that long after the shooting in Nova Scotia, where an RCMP car had been, or what looked like an RCMP car had been used. Compassionate exemptions were being implemented through public safety, even if decisions were coming from health. And there were people left without caretakers as a result of decisions being made, and I was dealing with public safety. So, can you talk about why those things aren't in here?
No, thank you for your comments. I think it's important to understand that, you know, when we are performing audits of departments, we're auditing against the directives and the policies that are given to the departments to implement. So when they get a policy, it's about applying it and the consistency for letting someone in or the refusal to let someone across the border. Audit standards prescribe the level of evidence that we require. I don't contest any of the things you're saying, but then I need evidence to be able to support these matters and bring it forward for recommendations and to support our audit findings. And what you see here today is what we can find for evidence to support the matters and the implementation against policy, against the government mandatory orders. And, you know, we've discussed the themes of our work and the early challenges with record keeping. The department went from its early days of paper-based records, quickly established processes. Sometimes in cases, it made improvements as they could throughout this process. Certainly not perfect, and certainly the first time we've ever incurred such a thing. But without adequate evidence, as professional auditors, we're limited in what we can report about some of these matters. And it is about auditing to policy, auditing the key matters, and providing those recommendations for the future improvements. So certainly there's probably much more that can be done in the next pandemic to address concerns like what you and your constituents have. And I'm sure that you in your role are providing that feedback to the department, and I hope they listen and they use it with respect to our process. I think that was good, that what you're providing is good information for them to help utilize in their after action review.
And I guess what I'm concerned about is that it's not in here, and I was hoping that this would be able to be used as a deeper dive into what needs to happen for preparedness. And so if those things are missing, I'm really concerned. And I can tell you, I have evidence for all of those things, and I have sent it to government officials and to different people. Sometimes I got responses. Sometimes we were able to fix things, but there are so many issues, and I'm thinking about the people who are not being captured here, people who had disabilities and seniors who needed caretakers, and their caretakers were no longer able to cross the border, and public safety was implementing that policy. And in here, you did say they didn't have evidence around how they were making decisions, and I'm I'm extremely concerned about that. I'd be curious to know more about that. I'm extremely concerned that the Department of Health couldn't provide any evidence for any of the decisions that you sampled. I don't know 33 what percentage that is of how many decisions made, but that they couldn't provide any information.